Welcome to the Medical Collective, your go-to podcast where medicine meets real life. I'm Dr. Keisha Davis, a pathologist, personal trainer, and your host. I will be joined by a vibrant team of doctors who are not just healthcare professionals, but artists, fitness enthusiasts, and advocates for change. Each episode, we dive deep into the world of medicine, from untold stories of the healthcare industry to the latest in medical advancements. We're here to bring your insights, answer your burning questions, and explore the art and science of healing. So let's get started and step into the world of the Medical Collective. Hello, everyone. Welcome into another episode of the Medical Collective with your host, truly, Dr. Keisha Davis, MD. I'm a pathologist, a personal trainer, and the host of this amazing podcast. So let's get into another episode because today we're talking about the reality of medicine that no one really speaks about. So there's a version of medicine that you see online, and then there's the version that we actually live. You've seen the recordings of people dancing down the hallways, the movie music going while the doctor is dancing and having a great time in the middle of a procedure. But sometimes the version that you see online does not match the reality. And it can make you question everything, including your own worth, when they don't match up. I want to talk about today what this is like. I know that I don't want to criticize anyone, but I just want to clarify what's actually happening because it's true. I'm sure you've been through training, and sometimes once you get out and practice, you wonder, wait, this isn't what I signed up for. Now, what do I do? So let's talk about that pressure and why people are wanting to leave. Before we even talk about social media, because I know that we're going to talk about the stories, you're thinking about the most recent story about a physician that wanted to leave after 6 months. I want to acknowledge something. Burnout is real. It is 100% real. And a lot of us that are in medicine, and Dr. Leslie Ann, if you've ever heard her, she doesn't even like to use that term because the problem that's going on is deeper than that. When you say burnout, you're blaming it on the person. The person's just tired, not the system, right? The system is the problem. So when you have a broken system and you have people that are trying as much as they can to have autonomy, to take care of patients, but the system is working against them, it's more than burnout. It's more than just work fatigue. There's been a loss of autonomy in medicine. There's emotional exhaustion, and we know during the pandemic how emotionally exhausted we were. Trying to save patients, not have the PPE that we needed, not have the testing that we needed, and dealing with the frustration and the lies all coming at us at one time. That is an issue all in itself. Then we have the administrative burden. The administrative burden is something that people don't understand unless they're in medicine. They think that doctors, especially those that are not in private practice, that they have still autonomy. They have the decision to order a test, to order something for a patient, to spend 30 minutes to an hour on a patient without repercussions. And it doesn't work like that. Doctors are compensated sometimes based on how much they do, not the quality of the work, which are RVUs. And people don't know about that. So imagine that you were in a setting in the medical center, so you didn't know, you just got paid a set rate. But when you go out and start practicing, you realize it doesn't work like that. Then also there's the responsibility of life and death decisions. I'm behind the scenes doctor, and you all that have been part of these conversations know that I'm a pathologist, and my decisions are sometimes life and death, but I'm not front facing with a patient. So when I'm making a decision, I still worry a lot of times about, is this decision going to affect the patient? And I need to make sure it's right. But imagine being an ER doctor. Imagine being a hospitalist, an OB-GYN doctor, and you are sitting there watching a patient decompensate, and you're responsible for what you do, what you decide to do. You take it home with you. It can be a lot. And I want to share with you some statistics because I like to be grounded in facts. I can share my stories and my friends and colleagues can share their stories, but you want to know data, right? So let me show you and tell you the data. Since 2020, and we all know what happened in 2020, right? 2020 was a hard time for many of us during the pandemic. Over 20% of physicians reported leaving or planning to leave their practice within 2 years. So let me set that up. You can say, oh, they were just planning to leave. Think about it even in a marriage or in a relationship. When you decide you want to leave, there are already cracks, right? You are already emotionally absent from the relationship in some sense. You have one foot out the door. So imagine you're practicing medicine, you had this love. You were never going to leave it. And now all of a sudden you're starting to question it. That's a problem. Burnout peaked about 60 to 65% post-pandemic. So as we were starting to get out of the pandemic, we already saw more physicians having burnout. And I put quotations around that. And nearly 1 in 3 physicians have reduced their hours or changed their roles since 2020. I'm one of them. Dr. Sharon is one of them. Dr. Leslie Ann has been one of them. Dr. Tusa has changed the frame and the way in which she works. And Dr. Dan has been. He knows. He does ER medicine, but he does it under his own terms. So these are true. The pressure in medicine is not imagined. It's real. It's heavy. It's deep. And I will be honest, I've had many moments where I've questioned it too. I've questioned, should I be here? Is it time for me to leave? Is it really worth it? The part of medicine that people don't see is that you don't just go to work. You carry people's lives with you. Imagine it to an actor that has to assume a role and spends a year or years trying to become this character. And you've heard of them afterwards how they have to relinquish all of it. As a physician, this is not acting. This is not a movie. You can't get off set. You are literally watching something that has changed somebody's lives for the rest of their life. And you had a part in it and you saw it and you had a connection. Some patients and doctors have relationships for 5-10 years. My daughter's doctor has been there since she was born. There's a relationship there. So if something were to happen to me or to her, it would affect us. And imagine every single day you're having those micro traumas happening to you. It's going to affect you. And the weight does not turn off when you go home. I even believe for ER doctors, they are great at being able to put on that face, right, in the middle of a trauma. But I do believe that internally that it's going to affect them. It just depends how you process it. When you leave residency, that also, I believe, is something that physicians don't understand. When you are a resident, you have an attending. It's kind of like children. I have a teenager. I have 2 children, but I have a teenager right now. And they want to be independent and they need to learn how to be independent. But they still have a roof over their head. They can make mistakes and still come home to us. They can make mistakes and still have us there to get them out of those situations. But the minute they become of age and they leave the house, we're not there. We're not there for those mistakes. And when a resident is now becoming the attending or going into private practice, they don't have somebody right above them. That cushion has been taken away. And sometimes that's when reality sets in like, oh my God, this is real. I didn't expect it to be like this because you don't have the cushion, the crutch to lean on anymore. So when people start thinking about leaving medicine, that thought did not come out of nowhere. The illusion is sometimes what clouds the reality. At the same time, there is this other narrative happening. That doctors leaving medicine, they're happier now. You see them. You can live like this too. You can have this life. the flexibility, the income, the freedom. That's just all miraculously happens because you have an MD. That title, now all of a sudden, gates have opened. You can do whatever, even if you don't finish residency, right? Because you have an MD. It's not the truth. That you can become a coach, and that term is being used loosely, and I will say that. The term coach has become something that anyone can attain, and once you're a coach, you can do whatever. No. You can be an influencer. You can build your brand now. And it looks so amazing that it happens overnight. And it's really a new lane. So the same work you put into medicine, you're going to have to put into that. The rise in physicians moving into non-clinical roles has increased since 2020. And you will see it. You see it on social media. It gets amplified on social media. But there has been a surge in medical influencers. Especially during the pandemic, more of us were doing it. My thought about doing it was because there's so much disinformation, I need to counter it. It wasn't, I want to be an influencer. Now you have medical students that want to be influencers. You have people in training that are trying to be influencers during the journey and they haven't even made it there yet. Sometimes that can take away from your studying. I now see people wanting to be influencers because, yes, there is this effect, right? It makes you feel good when you get likes and clicks. And we're human too. Physicians are human. Especially in my field, we don't get seen. We do not get seen at all. So imagine you finally are in front of a camera or in front of the screen of someone's phone and they're liking what you have to say and you've never gotten that before. It seems surreal. Seems surreal. Gen Z, early millennials are definitely the ones doing the content creating and doing it well. And as a Gen Xer, we're trying. We are trying. But something people don't realize is that we're comparing our real life to someone's curated life. Okay, we are comparing somebody else's real life to our curated life because we've deleted segments of it. We've increased the brightness, the volume, the good times, not the frowns, not the wrinkles, not the tears, except when they're curated tears, right? To nag on you. But they're not the same thing. And that is comparison. It's where things start to shift in a dangerous way. So let's talk about it. Let's talk about when this becomes dangerous, where the conflict is. And this is where I have problems. And the reason why I'm doing this episode is that sometimes what we're doing is we're becoming something that we haven't finished even becoming. Now, saying that you're going to talk about the journey of going through medical school, that makes sense. That is your pain point. But if you're saying you're talking about the journey going through medical school to become a physician and you want to be a physician coach, you didn't even finish to be able to practice. You stopped in residency. You stopped 6 months after. So does your pain point change to become an influencer? Or are you still going to keep on that pain point, but you stopped? So now you have gotten all these medical student aspiring physicians to follow you, and then you stopped. So you now have an influence, and you have basically jarred them. They're confused. Oh, I guess I should stop too? Oh, I should be an influencer too? Oh, I can't become a surgeon? It confuses. It confuses your audience. It does. Skipping training rigor, building authority prematurely. You have to think about that. So how can you guide someone through a journey that you haven't even finished yourself? How? Hello, listeners. We want to remind you that you can catch The Medical Collective on all your favorite podcast platforms. That includes Apple, Spotify, and YouTube. Be sure to hit that subscribe button so that you never miss an episode. We're also on Libsyn, and you can find us on all social media platforms as The Medical Collective. Do you have thoughts or questions? Please don't hesitate to reach out. We love hearing from you. Now let's get back to the conversation. Because in medicine, the value is not in starting. It's not just in the journey. We know that in the middle, but it's in the completion and the continuing, right? That's another thing. When you get that medical degree, you aren't finished. You've just begun because you don't have a specialty. Which is why when you look online, you see someone that says doctor. What are they a doctor of? They say doctor of health. That's a red flag. Where did they get their training in? I'm a doctor in pathology. Dr. Sharon is a doctor in obstetrics and gynecology. And I could go through the whole co-hosts. They have their specialty, so they finish their training. Then they didn't stop, because if you stop, it's like my husband, he is the amazing cook, but if he bakes, he thinks that he can use the same premise and take things out prematurely. And then they're not good, right? Baking bread, you can't take it out early. It's not fully done. So you finish training, you're not fully done. Because you know what makes you a great physician? Years, different practices. I have been in private practice. I have been in an academic setting. I have been in locums where I'm in the middle of nowhere with nobody. And I still know I'm not perfect, but I know that now I have an edge upon other people because I have experience in years. And I may be a Gen Xer, but I have something that many other young people do not have, and that is experience. We each have our own, but with that edge, we all can't say that we're influencers of practicing physicians that with 10 years or something, right? And if you haven't finished it, you need to cook first before you show your dessert, right? You got to cook it, bake it, then let's talk about it. And then when we get to something even deeper, which is titles versus training, I've alluded to that, a medical degree. I have seen people that have gotten medical degrees, and for some reason, and some of them, it has been issues. Others, maybe it was just life happened. Life is lifing, and they had to stop. They have a medical degree, and then they go on to become consultants, okay? You only know what you know. So you have the medical school training, but if you're consulting, say, in surgery, in a surgical device, in a company, you haven't practiced. You haven't gotten a residency, so you have no specialty. You just have the 4 years of medical school. Your consulting can only go so far. Can only go so far. And I think that we're doing ourselves a disservice too. We have to know what our limits are and what our abilities are and what our scope is. Then what happens with that is sometimes a misalignment of credibility. Oh, they have an MD, they're a doctor. And I ask people all the time, oh, what are you a doctor in? Where did you do your training? Where did you practice? What is your NPI number? I ask those things to people all the time. And if they are a practicing doctor, it does not offend them. Now, as a Black female, sometimes it depends how the questioning is landing. Sometimes it does come with a little bit of underlying misogyny, racism, or something. They're asking because they don't believe you. But you have the right to ask a physician, anybody, what their training is in, what their specialty is. And if it doesn't make sense sometimes, y'all, it's because it's not true. And there is a responsibility attached to medical identity, which is why when you actually truly do have training, you don't just spew off the mouth all the time. Now, if you're in private practice, sometimes you're going to tell the truth. Like there's an anesthesiologist, she tells the truth, and I appreciate her, but she has her degree and she earned it. But if you don't have a medical identity, you don't have a responsibility, so you can say whatever you want. You're done. Or you didn't start. Titles carry weight, and that weight comes from training, it comes from experience and accountability. So that's where, and I will talk about, right now we have a Surgeon General nominee that has not gone through the Senate, has not been confirmed, and that's Casey Means. I speak about things because they need to be discussed, not to hate on anyone, not to discredit anyone. But I want you to truly look into it, and I've spoken to people. If you do not finish your training and you want to be a surgeon general or you want to be in a position that requires said training, that's a problem. You need to find out why they did not finish their training. And there were ethics issues why she did not finish her training. It was not just, oh, I decided to quit. If I want to share and show people that there are fractures in medicine, but I want to be able to change it, I still have to do the work to become a physician, to become a pathologist or whatever my specialty is, and then I can work on changing it. Look at Dr. Tusa. Dr. Tusa is a board-certified allergist, immunologist, and pediatrics. She has many other titles, many other degrees, but she also does integrative medicine. She knew that she didn't want to just practice in a box of traditional medicine and help children with allergies in a holistic way. She knew she had to get the training first, right? She knew she had to know the history of medicine. She knew she had to use data and facts. And then she could take in and add her integrative medicine practice and other ways to treat people besides just what we call European or Westernized medicine. Because it really does take that type of fervor. But she couldn't stop and say, okay, I'm not going to finish medicine. I'm just going to go in and just start saying stuff because I believe it. You have to have the foundation. And that's what's happening, is that some doctors are not understanding that. They want to skip steps. It's like some of these houses built today. They skip steps, and then we have problems later with cracks in our foundation because it was rushed. It was rushed and things were skipped, right? It just doesn't work that way. So remember that you have a title, it carries weight, and you have to have the responsibility of it. Because when something happens, this is the part that scares people, when you no longer are in residency and you don't have anybody over you and someone dies, you miss a serious illness or cancer. Even if it was in your practice but you weren't there, who's responsible for it? You are. As the physician, as the medical director, you are going to be responsible for it. So the reason why you now have said degree and titles is that you also carry that responsibility. You're responsible for everybody underneath you. So if you don't pay attention to who's hired, their credentials, their training, what they're doing when you're not there, you're going to be responsible for it. And that's the unpretty part of practicing medicine. That's why when we say, or my father used to say, call me doctor, it wasn't because, oh, I'm trying to show off. It was because it comes with a responsibility. I worked for it, I earned it, and I also respect it. And when influencers start replacing expertise, what happens? Everyone becomes confused. The general public are the ones that are going to be affected by this. Visibility is now expertise. I was on a panel one time when I first started back doing social media on the TikTok, and someone says, and I don't think they realized, they were like, oh, this person came up and they only had like 10 followers. Why do I need to trust them? And they had probably like 50,000, 100,000 followers. Do you know the person with 10 followers or less than 100 followers had more expertise than the room that had thousands of people listening to this influencer? Right. Because to be honest, and for me, it's because I'm part-time, people that are truly experts don't have time to put into growing their social media account as an influencer does. So something's going to have to give. So we got to quit looking at numbers to realize that those necessarily are not the people we should be listening to with our health, our legal matters, our relationships. Those aren't the ones. So we're watching expertise be replaced by visibility, and they're not the same thing. But what we can do is we can make the experts more visible by sharing, liking, listening to the Medical Collective, sharing our podcast, and many others that are doing the work. I want to pause just a minute because I want people to know it doesn't mean that medicine has lost its value. I don't want you to think also that people that have thousands of followers, you shouldn't trust them, because there are some doctors that are doing very well on social media. But I want you to know, medicine does still matter. Social media is a platform that actually can be used to uplift and educate people on public health and other medical issues. But the system is flawed, not the profession. The system is flawed. And we have to realize about our identity and our environment. Medicine did not lose its value. Our environment changed. Social media was added onto it. You have a whole bunch of what I call spam, right? You have a whole bunch of spammers or trolls that are trying to confuse you, right? So you're trying to look right and you see, and you're trying to reach that knowledge. And then along the way, there's a bee that gets you. There is some trash on the road. There's a whole bunch of stuff that gets in your way, and billboards that are full of nonsense, and they're trying to distract you from the actual information that's like, it's almost there, but it's like a foggy day, all of these things. And that's what's happening. That's what I think about the environment we're practicing in is the roads, the cracks in the roads. All of these things are distracting us from what's always been there. Always been there. And I also say this to that person that has been in this, that the person, you, whoever wants to leave or doesn't want to go into it, you've really got to question. You've got to think, and you've got to question why you're doing this and for what reasons. And did you even have the right reasons to begin with? And for many, I'm sure they did. So we've got to reframe things. And I want to offer some guidance without being prescriptive. And I don't do prescriptions because I'm a pathologist, but I do give diagnoses. I want you to be able to build alongside medicine and redefine your role. One thing that happens when people get out and start practicing is that they think it's just going to be like these beautiful blooming days and everything's going to go their way. There were a lot of things, especially the business of medicine, that we probably didn't have enough exposure to. And so that can be overwhelming. You also have to realize that with technology, AI, these things can help you redefine your role. You, as a parent, there are days sometimes that as parents, we want to throw our children away, right? We just want to run away. But we have to go back and redefine our role. Okay, from 0 to 10, this is the type of parent I need to be. Now that they're teenagers, my role as a parent has changed. That doesn't mean I throw my child out or I run away and go live on a beautiful island somewhere. I don't do that. But I redefine my role as a parent before anything. Now, when they become adults, now your role has changed again. You're still their parent, but they're not in the house. And as a physician, we need to realize that. Early career physician versus mid-career versus late physician, and then late career physician. And then, depending on the time, as AI may replace some of the things we do, the way we practice is going to be different. If you have 2 children, who says you can't work part-time? Who says you can't? If you are a surgeon, who says that you have to work at a certain place? Who says you can't get some surgeries out of the way, work a couple years vigorous, and then pull back and reevaluate? Because I think we do have a duty. Is, again, people always ask you, there's so many checkpoints asking you, are you sure you want to do this? High school. Are you sure you want to do this? Pre-med. Are you sure you want to do this? Medical school interviews. Are you sure you want to do this? The MCAT, the test. Are you sure you want to do this when you get into your specialty? Are you sure? You get your degree and you're done with your residency. You are sure. So the distractors, social media, and this beautiful light that, oh my God, you can be an influencer and that's where it is. We love you, doctor. But the reason why they love you is that you are a physician and that you have done the work, but don't let that distract you from there is a struggle. The struggle is real. And you're made for it because you made it through all those checkpoints. And right at the end of the checkpoint, that too is the distractor. And you can still be an influencer, but you have to redefine your role and realize that you took a position, especially in a very challenging, competitive field. You took a position from someone that could have made it, and you were granted this opportunity. Now, what are you going to do with it? That's the challenge. It's a test. It is a test. And when you walk away from something, like when my child walks away from me, they know I'll always be there. In medicine, it's not as easy to get back. When you walk away each day, it's kind of like a car that leaves the lot, it depreciates. It's going to be harder for you. Your experience, the cases you've done, when you try to get credentialed at a hospital, the longer you're away from it, the harder it is to get back in. So that's when you can't jump completely out of it. That's when you like tiptoe out slowly. And like what I'm doing with locums is I still keep my credentialing up. I still keep my skills up. And I still have time to do other things. And I also know people are watching me. So everything I say bad and going through something and sharing the struggles is one thing, but jumping out of it and being like, oh, I just want to be an influencer. I'm just going to do podcasting, forget medicine. The medicine is the hook that is what's bringing people in. So you've kind of lost your content when you're no longer doing that field anymore. You stopped. You're going to become stagnated. And the reason that you pulled people in was because you were going through this and you were going to become this. So think about that. Please do. Please, please do. So some people don't want to leave medicine. They just want relief. That's another thing. Sometimes we think it is that we want to get out of it. Like sometimes I think I don't want to be a parent, but that's not true. I just need relief. I just need that vacation. I need help, encouragement. I need to talk to someone. Yeah, therapy. Who said you wait until you're in dire needs for therapy? Talking to someone outside of your family, therapy, yes. To make you rethink things, reevaluate the situation, try to change things around. Your mindset can change a lot. So that is the real crux of everything, is that realize it may not be that you want to leave medicine or whatever your field is in, but that you just want relief. And depending on how you view that, you can make a lifelong decision that can be detrimental, or it can be amazing. So we want to be clear. Before you walk away from something meaningful, make sure you're not reacting to what you're seeing. Make sure you're not reacting to what you're feeling in the moment. Make sure you're not reacting to the likes, comments, and shares. And make sure you are paying attention to what you need. Make sure you're paying attention to what you went through to get here. And remember what your initial purpose was. If this conversation resonates with you, if it does, and I hope it does, I want you to go back and listen to my Enduring Faith in Science. That was my own personal story. There have been many days I wanted to throw it away, but it connects to this conversation directly. And I hope this moved somebody. You can go to the medicalcollective.net website and you can put in a comment. Join the family. There's resources for you there, and you also can ask your questions for the next episode. Until next time, take care, everybody. Thank you for tuning in to the Medical Collective. We hope today's episode has left you with valuable insights and a new perspective on healthcare. Don't forget, follow us on social media for more updates and behind-the-scenes content. I'm Dr. Keisha Davis, and it's been a pleasure to share this time with you. Stay healthy, stay informed, and we'll see you in the next episode, where medicine continues to meet real life. Please note that the content provided in the Medical Collective podcast, including text, graphics, images, and other material, is for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed on this podcast are solely those of the individual authors and guests and do not represent those of the Medical Collective, its staff, and any affiliated entities. The appearance of content on the podcast does not imply an endorsement. Neither the host, Dr. Keisha Davis, the co-host, or any guest of the podcast bear responsibility for the accuracy of the content provided or the use of information received through the podcast. Reliance on any information provided by the Medical Collective podcast, its employees, writers, or guests is solely at your own risk.